Okay, we're doing it.
Yeah.
Which one's Facebook? Which one's Instagram? This one's
Facebook.
We're both
And YouTube.
YouTube.
No one's Instagram.
No. I'm 40. I just want to throw that one out there. And I've only drank like maybe 10% of my coffee. So I feel like that maybe one more cup in and I'll know the difference between YouTube and Instagram. But they're both red.
No, they're
No?
not.
I don't have Instagram.
Instagram's kind of pinkish.
Purplish. Yeah, I can see it in my head a little bit now. Okay.
Not fine red.
Yeah.
Anyway, shout out to Heavenly Grind this morning, even though there's not a logo on there, but
There's not,
represent.
but they are fueling our side this morning.
That's right. That's it. This is how we're gonna do it. So today we're talking about wellness stuff. We've been talking about wellnesses. We skipped a bit for the dentals.
Mm-hmm.
So we're gonna circle back on just kind of closing out what wellnesses look like here now, and then talk about preventions.
Yeah.
Because that's kind of the other really big part of wellness stuff.
Yeah.
Preventing.
Sure. Preventing those diseases
Yes.
that we test for.
Yeah, we think about prevention in terms of vaccines, like that's why you're going to the vet, but you also
Mhm.
need to prevent the parasites, the creepy crawlies on the inside and the outside.
Yep.
Okay.
Inside and outside. That's a little
Inside and outside.
disturbing.
Yeah.
I mean,
The ones on the outside, we're thinking about that. We see them.
Ugh.
The ones on the inside, those are the ones that'll sneak up on you.
and cause some problems.
Big problems.
Yeah, for
Yep.
sure.
Okay.
So, okay. Let's start with heartworm prevention
Oh, yeah.
because I slapped a mosquito off my horse this weekend and I was like,
Already.
already.
Yeah, but honestly, like last month, it's always in my closet. But I was standing in my closet and I saw a mosquito on the wall in the dead of winter, which I think a lot of people don't realize that mosquitoes do live all year round, and there's several that live specifically inside. That's kind of their jam. That's how they do it, is to get in your house and live there.
Yeah.
Why are you talking about mosquitoes?
They're the introverted ones.
The introverted mosquitoes. They don't go outside as much.
Stay in the
Yeah.
house, thanks.
Yeah, it's cozy in here.
Yeah, there's a lot outside.
There's a lot.
So why are we talking about mosquitoes? Because they just bite the dog and leave, right?
That's all. Yeah.
But what do they leave behind? They leave behind heartworm babies.
Heartworms.
Yeah.
Like 10 dogs on average we treat a month here for heartworms. It is ridiculously common, also ridiculously preventable. One of the most preventable diseases we have. The efficacy on a lot of our heartworm preventions is still up in the 98-99 percentile, which is way better than most vaccines. And heartworms kill dogs if they are left unchecked.
Yep.
So it is highly preventable and highly fatal if we don't prevent and or treat once we find them.
We've had a few of those fatalities here recently.
Ugh.
Yeah, just rough.
Yeah.
It's just so sad seeing those dogs. They go into heart failure.
Mm-hmm.
And you manage the heart failure as best you can, but you almost get to a point where until you get the heartworms out, and that's a process.
It is a hard job
And
treating heartworms.
maybe we got two lovely doctor brains, but from a non-doctor brain, one of my most valuable things y'all taught me when I started here was how from bite to heartworm disease, the cycle of the life cycle of it, how it works. So maybe explain just a little bit of once they bite, this is what happens, this is how long it takes to reach this, and kind of give people an understanding of why we test yearly.
Yes, prevention, why we're testing.
Because that's part of our wellness package and what the lapse can be and so forth and so on. It's valuable stuff.
Yeah.
So, man, how detailed.
Yeah, let's see. One semester crammed into the next 6 minutes. Go.
Yeah, right. So basically, the mosquito incubates the first little bit of the heartworm life cycle. So they're integral to being infected by heartworm disease. I've gotten some questions of hey, my dog got in a fight with a heartworm positive dog. Could we now have heartworms? And the answer to that is no, because we have to go through the mosquito. And so then the mosquito bites the dog, and it doesn't really matter where they bite the dog because those little baby heartworms, so there's multiple stages, but the stages that live in the dog are the L3, L4, and then the adult heartworm. So those little tiny
L stands for larva.
Larva, yep. Right?
Mm-hmm. Yeah, you want worm larvae in your body. Sounds great.
So L3 kind of migrates through, and L4 is getting close to the heart and then establishing it in the pulmonary vessels. So those are the vessels that go to the lungs. and then that adult heartworm sets up there. Now that whole process, that migration through the body takes about 6 months roughly. And so that's why we test annually. That's why if we switch heartworm preventions or start a new prevention, we're going to recommend testing both before we switch and then 6 months after. With the preventions that we use here at Northside, we feel like they are good enough preventions. They are in that 98% that I don't often make my patients test. I don't know about you, but it's like, but that's the guarantee for those products that you have to
because if there is breakthrough, they'll pay for the treatment. That's what she's saying, as long as you follow testing recommendations.
As long as you follow those testing recommendations. And that's why we say those 6 months is so that we make sure that we're hitting any breakthrough that we may have had, and we know for sure. And so then also testing annually, again, 98%, that's pretty dang good, isn't it? But if your dog's getting bit by 400 mosquitoes a year, you may still have a breakthrough infection. So that's why we also recommend that annual testing.
Well, and there's also those little dogs. There was one in particular I remember years ago, and this sweet lady had this little poodle, and she was giving it its monthly chew every month, faithfully. And then they get ready to move a new couch. They're going to get a new couch. And they scoot the old couch away from the wall, and guess what there was behind the couch?
All the
heartworm prevention chews. It was Interceptor. And so you don't always know with those orals, but the big fear, of course, is that you're going to test them as negative. They would have been hypothetically bit by an infected mosquito 3 months prior, and so you've still got 3 to 4 months before a test can be positive. It's pre-patent period, so we cannot detect the disease for that entire 7 months. Now it's still safe to put them on preventions during that time, as opposed to if they're full-blown heart disease and the adults are making all of these baby heartworms in the bloodstream. When we treat with certain preventions during that window, we can actually create anaphylaxis. So that's why you'll hear veterinarians get really stressed about putting dogs on heart prevention prior to testing. Not all of them will do that. So we do have ProHeart and Advantage Multi or offshoots of that are safe to use in a positive dog, but you still need to know what you're up against.
Yeah. So that's why, with Interceptor, if we don't know that your dog's been on it, we'll ask you to wait until we call you with those results. And that's the reason is, we don't want to send them into anaphylaxis at home, and you're sitting there at 7:00 and because you just gave it with their dinner at 6.
Yep. Oops. Yeah. And it's, I think, something we sometimes don't get to talk about enough in the room, just because there's so many of these wellness things we're going over. But again, just recognizing that your dog can be negative, start heartworm prevention, and then still become positive. And that was not product failure. It was the pre-patent period issue. And so that's why we retest. And it's not that common that it happens, that they'll break positive at the next test, but it does happen. And you've got to know, because what if you don't know? What happens next to the dog?
What if you don't know
that they're heartworm positive, and you just keep on giving heartworm prevention?
Then you can end up with heart failure.
Yeah, the adult heartworms will still live in there and grow and do heart damage.
You think you're fighting a problem that you're fighting.
Yeah, you can still have. And why does it take 6 months for them to test positive? That's because that test only detects the female adult heartworms. So it's the little antigens produced in their uterus. So I know we're uterus. Sorry, I made a face. So that's the best test we have, unfortunately. So it does take until those adult females are trying to make babies that we can actually detect.
And some of the old school tests, they would just take a drop of blood and actually look for the baby heartworms on the slides. But there's two problems. Microfilariae check. The two problems with that, one is that you may just not see a baby swimming around in that particular drop of blood. It's a relatively large creature and the dog is compared to the worm, baby worm. So the other problem is if that dog is on a heartworm prevention, it actually will wipe those out of the bloodstream. And so that hypothetical dog that has heartworms, but you don't know it, you start them on prevention, then later that antigen test will be positive, but the blood test will actually still not show any microfilariae because the prevention is wiping them out.
Yeah. Miss Carol Garrett says she loves that.
Oh, the shot.
There's a shot. Yeah, me too. All of my dogs are on ProHeart.
Yeah, I will admit that like I was not super compliant with the oral preventions. I forget. Like I would set reminders on my phone and everything, and I would just
and they go off, and you'd be like, "Well,
I'll do that one." Or I'll do that when I get home, and because the prevention will be at home, and me and my dogs will be at work, and then you forget because you get home and distracted. So shots are amazing. It does have the 6-month and the 12-month shot, which doesn't do as many intestinal parasites. So sometimes people will opt for the orals for the like whipworm control. But if you don't have a dog in a like heavy parasite burden area, you don't have a history of whipworms in your space, then usually that prevention injection is fine. And then we do their annual fecal checks at our wellnesses as well. And if they actually become positive on any of those tests for an intestinal parasite, the ProHeart company will cover intestinal parasite treatment. So you're not out anything if for some reason that your dog did get exposed to whipworms.
Which is really, really nice.
Best of both worlds.
It is. So do love ProHeart around here. What else were we going to talk about?
So the next thing we can kind of go over a little laterally is when you're talking about.
I should see the hand motion.
We're going a little lateral.
We're talking about, we've been talking about heartworms and why the preventions are valuable. Our 40X test, which is part of our wellness package, also shows what can happen if we're not on other types of preventions, which is flea and tick. That's where we can pop up the tick diseases and things like that as well on the same test as the heartworms. Could you tell us a little bit about why we like certain products and their efficacy in our particular area, why it's important to be on that, whether your dog is indoor only or not, and what can happen if not, and maybe like ehrlichiosis is one we get a lot around here. What do we see with that?
LJ didn't know there was a shot. Sister, we got you.
Yeah.
Don't you worry. We're going to fix this. They have to be at least 6 months old. So that's the one thing. But anyway.
LJ and Miss Carol, hi.
Yeah, they're waiting. Not just him. Go ahead. What do you got on that?
Okay, so Rachel mentioned ehrlichiosis, which is a tick-borne disease. That test that we use to test for heartworms, a lot of times you'll hear us call it the heartworm test, right? But it actually tests for a lot more. It tests for ehrlichiosis. All of what I'm about to list off is going to be tick-borne diseases. So antibodies there, anaplasmosis, Lyme disease. So all of those come on that test also, and they're all spread by ticks. Yeah. And so keeping, kind of segueing into like tick preventions, we love NexGard around here. We also carry Bravecto.
It kind of depends on your dog's risk factors.
Yeah, because it doesn't kill the Lone Star tick for that full 12 weeks.
Yeah, so you'd have to redo the Bravecto at 8 weeks to get that same coverage.
Yeah, and then your cost goes up.
Now, if you're mostly worried about fleas or you don't have a lot of ticks in your area, then it's a nice convenient way for 12 weeks of tick prevention at once. Yeah. But if you're in a heavy tick area
where we live, it doesn't fly.
In the country with the trees and the things and the grass
and the dogs that go everywhere. And you've got a dark colored dog and
with hair for days.
At least mine are white. And
yeah, the tick show. And it's funny, because a lot of times these dogs will come in and they'll test positive for like Ehrlichia is the most common in our area, and the owners will be like, "I never saw a tick," and that's really, really common because a lot of times the dogs will groom them off, find them or chew them off, or they'll engorge and fall off on their own in a secret hiding place.
Yeah,
because they're good at hiding. But yeah, so it's a lot of times people are shocked to find out their dog has been exposed to a tick disease.
Yeah. I mean, how many owners are checking back by the bum or lifting
under the armpits?
Yeah,
between the toes, under the ear flap.
Yeah, that
little weird little tuck of skin that they have in their ear pinna. I don't know what that purpose is.
Still do that nightly.
Other people don't do that nightly. Just Rachel.
Yeah, just Rachel. So yeah, all of those ticks can transmit diseases that. One really fun thing about Ehrlichia and Lyme disease is that they can cause kidney disease later in life. Yeah. And using fun loosely here.
Yeah.
The
Latin party hour.
So, it's important to know if your dog has it, but it's also important to keep them on preventions. I posted on my actual Instagram.
Your actual Instagram. That's the one with the purpley pink,
Yep.
orangey.
Yep. Back in January, my dog had gone out running through my pasture, and she came in. She had like 6 ticks crawling just up her back. I have this video shot in January of 6 ticks. So really important when you live here in Oklahoma to stay on tick prevention year round if you're high risk for ticks, but also still even if fleas are your only concern, right?
Yeah, absolutely. I mean, fleas, Sunny 72 in your house all year round. They love to set up shop in the carpet, in the dog bed, anywhere, even in like, for those of you like, I got hardwood floors, even in the cracks of the hardwood floors. Those suckers are designed for the apocalypse, honestly.
Them and roaches.
Them and roaches. Yeah. So basically, when we have a flea issue, we're not dealing with these same like SNAP disease, the SNAP test, we're checking for those, but anemia is a huge issue. And just local irritation, secondary skin infections from the itching. And with cats, there are like cat scratch fever, which actually is zoonotic, meaning we can catch it from the cat, from the flea dirt. Like if they scratch us and the flea dirt gets in there, you can get really sick from that. And so there are still diseases that are spread by fleas, even though really with fleas, our biggest concern is just the flea themselves sucking the blood from your pet and biting them and making them itchy.
Vampires.
Like little tiny vampires, yes.
And again, they can set up shop in your house. I think we see the most flea anemias like in November, December, when people are like, I can quit giving prevention. And then their house explodes.
Yeah, no, I agree. Or sometimes even like the January months and stuff with the cats, especially. I feel like the little ones.
I'm gonna botch the phrase. What's the phrase? An ounce of prevention is
worth a pound of cure.
So it is when you're looking at a budget and you're on a tight budget and you're down to rice and beans and your dogs are eating sweet potatoes, salmon, and rice and green beans. Not that happens.
Not that anybody does
in my life. Going ahead and paying for that prevention is something that'll guarantee you're not in here running extra tests and blood work and medications to treat the problem. So it is something that we see to be a very large value. But also kind of wrapping back around, I have no idea what time we're on, but
17 minutes.
Oh, we're doing. Way to go, ladies. Just talking about, we oftentimes offer this prevention at the wellnesses. And wellnesses have changed a little this year based on the education that both of you are getting and the way that medicine is growing, as it always does. So we have a little more like core vaccine versus lifestyle options in wellnesses. But one thing we don't ever want to drop off and probably believe is part of the core importance is in fact prevention of some kind to some degree for your pet, right? So maybe tell us a little bit about how wellnesses are going right now and roll that all in for us, ladies.
Okay. Well, so the big change for wellnesses this year, because we always try to stay as current as possible with ever evolving medicine and opportunities and so forth, and diseases, quite frankly. So this year we decided, because flu is, we've had cases in Shawnee now, even, but in Oklahoma for sure, and just recently in Shawnee. Flu vaccines are now important for dogs that are going to be in boarding, traveling, grooming situations, dog parks, and so forth. So really that's what Bordetella was intended for too. And so if you need one, you really need the other. There's not really a great example of when you would only need one of those two things. And so we decided to put those together as a lifestyle vaccine. We pulled the Bordetella out of the wellnesses, which helps keep the wellness prices from escalating as prices increase on all of our vaccine costs. So it keeps our wellnesses down. And then it also allows you to kind of customize your wellness based off of your pet's risks. So our goal would be every dog is getting their heartworm test and fecal and exam. Rabies and annual vaccine if they need it. Annual is typically going to be either your distemper, hepatitis, parvo, parainfluenza, and lepto, or just lepto, depending on their rotation. And then we are going to opt in or out of lifestyle vaccines based off of their needs. And then the big one that we're, honing in on today is then prevention for the parasitic concerns, the internal and the external parasites. So intestinal parasites, heartworms, and then flea and tick control. And so the reason that those aren't in a package per se is because they're highly variable based off of the risk of the pet, the lifestyle that they have, the size of the animal, the preference of the owner, and all of those things. There's a lot more options. Like rabies is rabies, right? You're getting 1 year or 3 year, but when it comes to flea and tick control, we have multiple ways that we can approach that. When it comes to heartworm prevention, multiple ways that we can approach that, and it could change throughout the year. Certain years, a time of the year, you may be more worried about fleas, and other times you're more worried about like the Lone Star tick, and so you switch to NexGard for the winter or for the summer, and do Bravecto in the winter. You could do all kinds of things, and that's very personal. And tailored to each pet. And so that's why those kind of are not lumped into the wellness, but those are the things that we're talking about at the wellness.
I love that. I also got distracted because I was just so like singing my NexGard jingle in my head, because you guys are.
Is it coming?
Oh, it's being filmed today.
Today's the day. The NexGard jingle is coming. It's brilliant. Oh my gosh.
Just remember that not all of us can sing, but only a couple of us, one of us, are willing to sing it. So. Okay, so having said that, I am guilty of one thing among many things, but particularly on these mornings, is not mentioning cats. So our lifestyle versus sport, I do it all the time because I don't have cats, but when you talk about how we kind of have our canines, we've got a little more option now. Cats have kind of always had that versus like high risk, low risk wellnesses. Yeah. And you can just like maybe drop a bucket in the
a bucket in the water?
You could do that and pull it back up full. I mean, it still works.
Yeah.
What's but the maybe goal? Just talk that's a great idea. To go with the goal. Maybe talk a little bit about cat prevention, and that yes, we will touch on cat wellnesses more at length, with more just going into why we test for what we test for them, but that their prevention is also, whether they're high risk or low risk, important.
I've been creeped out about how many heartworm positive cats we've been seeing lately.
I know, it's been wild.
I think we can do a whole next Wednesday maybe on just cats.
But that is something we're checking for.
Yeah, so
they don't get flu vaccines.
They do not get flu vaccines. There's not a cat flu. They do get their upper respiratory because they do have other upper respiratory diseases. And then they get leukemia vaccine if they are tested negative. And how often they get both of those actually depends on their risk factors. So if you have a cat that is entirely indoors, then they're only getting those every 3 years, versus if you have a cat that goes outdoors frequently, then they're getting those every year.
Or if you're bringing in new cats.
Sorry,
a new one.
Yeah,
I did.
Nailed it. Yep. So if you're bringing in new risk factors, then you might, regroup that plan as needed.
Yeah. So definitely, I feel like for cats, even more so than dogs, it's important for you to use an owner to tell us as their healthcare providers what their life looks like, what has changed in the last year, because we're going to use all of that information. If you've built a catio and previously your cat was only indoors, that's important for us to know, because even though they're probably not going to get in a fight and be exposed to leukemia or FIV, they still are at risk for upper respiratory stuff if they're spending a lot of unescorted time out on the catio. And so those sorts of details are really important. And then going back to Dr. Keith said about heartworms, heartworms in cats, there's no treatment, y'all.
Yeah, and their first symptom can be acute death. That's fun,
isn't it?
And again, not fun.
Not fun. Yeah, fun.
Hard.
But keeping them on prevention becomes even more important.
And so, indoor only cats too. Like, I mean, I've seen more indoor only cats with heartworms than outdoor cats.
Yeah. Well, because we're
seeing them. Those are the ones that are coming out, right?
Yes, we're seeing them, and then also like they're not the ones that are being kept on prevention.
Good point too. Yeah,
because they're not
as perceived at risk.
Yeah,
but that's just actually not the case. Yeah, but it's how we perceive it.
Because I mean, I have horses, but I have mosquitoes in my house all the time, and so if your cat is inside and you have a mosquito in the house, like mosquitoes don't they're not like, oh, that's an indoor cat. Sorry, I can't
Yeah.
write that one.
Right? For sure. And it's like the best host in the house at that point.
Yeah, right. So anyway, yeah, keep your cat on prevention. We use Revolution Plus, right?
Yeah, Revolution Plus.
I can't remember.
Yeah,
if it's
and
plus
it
or
does-
extra.
It's nice. Yeah, extra. Revolution extra. We should put that into marketing.
Right.
Yeah, fleas, ticks, intestinal parasites, and heartworms, and ear mite prevention. So basically, everything you need your cat to be protected
And
from.
one convenient topical.
Yeah, the only downside is it doesn't get every species of tick, but it's covering so much. For your indoor cats, you're really not as worried about that. Especially if your dogs are on prevention. They certainly like you were saying, whenever the 6 ticks are crawling, you're finding them once the dog's been back in the house. But all that to be said, risks are definitely moderated in that situation. So, yep, once a month topical, done.
And then cats get a very nasty tick-borne disease too, called Cytox or bobcat fever, Cytozone felis. You'll hear us call it everything. But a lot of people hear it bobcat fever. And unfortunately, the strain we have in Oklahoma is over 90% fatal.
Oh, yeah. Like way over 90%.
Way over 90%, yeah. It actually made the veterinary news when Oklahoma State actually saved one of those cats a few years back. And those owners spent over $10,000, and that cat spent 10 days in hospital at OSU.
And it's still a miracle, honestly.
Right. And it made the news because they saved it, right?
Right. Louisiana, they have relatively high survival rates, I don't know, 60% or something like that, some of the data. But the strain we have here is not the same. And it's brutal. So prevention.
Yes.
So,
when you choose to live in Oklahoma.
Yeah, when you choose to live in Oklahoma. Prevention.
We live with poison ivy, poisonous bugs, poisonous snakes, and tornadoes.
Yes.
Have a cellar and put your dog and cat
on prevention. Yeah.
On prevention.
Yes. Tips for living in Oklahoma. Right? Get a cellar and put your dogs on prevention and your cats on prevention. Anyway. Okay, well, we're at 26 minutes. Anything else we've forgotten to cover you wanted to?
No, that was wonderful. And we'll touch back in next Wednesday with more cat information.
Yep.
One thing we did want to show you.
Oh. Well, we'll see. I don't know if you can really see, but
we're going to find out.
Yeah, we'll
You'll see a video later. But this is our mud pit.
You can't. It just looks like a giant shiny bit. You can kind of see it over here. Yeah, let's get this guy over at least. Sorry, YouTube. The Facebook people can see the mud pit that used to be our concrete pad. Yeah. As we are beginning phase 1 of remodel.
Well, it's more like phase 59.
Well,
but the first round you can see.
Yeah, the ground break per se. If you will.
Are you still in there, Dr. Key?
Yeah.
Okay. So yes, we've got some changes coming. Some changes happening. That was mostly a parking spot for you two. Sorry, guys.
I know. I got in this, I saw the live yesterday, but I didn't actually watch it, so I didn't quite realize where everything was happening. And I pulled in this morning, and I was like, where am I supposed to park?
Yeah, not in that. We'll never
do
get
not
your
recommend.
car.
Yes,
we'll never get your car.
Yeah,
but our back door is currently under construction. Our side door that used to be grooming, where we've been seeing lasers, is currently under construction. We will still meet you in the lobby, get you to the appropriate places, make sure you're comfortable. Just be patient with us. Big things are coming.
Yep.
So I always love it when both doctors are on. It means I get to sit. I actually stood back here this whole time like a big goofball staring down at y'all. But I love getting to see both of y'all talk and share your education. Because these are things that sometimes we don't have 20 plus to 30 minutes to explain in a room.
Right.
Or else your wait in the lobby would be so long you'd never come back. So this is the value to getting to see this on Wednesdays, and we appreciate your knowledge. Anybody got a good joke to part on?
You want to hear a good joke about pizza?
I would love to hear a good joke about pizza.
That's too cheesy. Never mind.
I was waiting because I knew it was going to be a dad joke.
Okay, gotta go back.
Oh, God.
All right. So, I don't even know how to. Oh, there it is. That's how we end stream. YouTube is new. Okay. Bye guys.
YouTube.
And Facebook, we love you.
Bye,
Bye.
Facebook.
I think I have to end. I did that yesterday too. Sorry, guys.
Hello?
She hates my Mac. There we go.